Because that's what I've always said is if I'm getting something done, just take my appendix too, because that
Right.
way I don't have to worry about it.
Right, right.
Well, supposedly you're healthier if it actually bursts and then they take it out.
What?
As long as you get it done quickly.
That's an odds game I don't want to play.
Yeah, it's a weird game, but I don't know why you're healthier, but supposedly it happens that way.
Huh.
Just a little bit of bile hits your system, that's good. You would just want to
Sterile
limit your
environment,
bile
just, like,
intake.
heat it up quick.
A little bit of septic.
Well, no, you want to get it out before that happens, but yeah, I have no idea why.
Pay no attention to Jan, everyone. Do not let your appendix burst.
No, you're probably
Just a
better
little
off
bit.
getting it out first.
Little bit
Dr.
contamination of the sterile environment and just be done.
Dr. Jana, is there any purpose to an appendix?
Not that I know of. That's why I've always made that comment, which is just take it out if you're in there anyways, because I don't know of any.
It's
like
a,
a
it's a
remnant.
vestigial organ that was useful when we ate a lot of raw meat.
Yes.
Vestigial. Thank you, Eddie.
So no
What would it
carpaccio.
do with raw meat? I don't understand that.
I think he's talking
Well,
caveman.
before we invented fire,
I know, no, but why would it help with raw meat? I don't.
All I know
I
it
just
as
wanna-
is
I
a
want-
something that causes
you can see
problems.
how clear the lines are of my sort of knowledge area. And as soon as we fall off it,
He
it's
threw in the
quite
word
sharp.
vestigial, which I've done enough media health communications to have left the word out, except I knew I'd get questioned about it. I'm like, I don't know why. It's just a remnant of something that we don't need or use anymore that causes people problems. So take it out while you're in there is always what I learned.
All right, I'm gonna just a quick anecdote and then we'll start for real. We were in, I don't even know, I think we were traveling, Beth and I, and there was some kind of like setup. It was like so like easy wife slam. And I said to her, honey, I just thought of something funny. And I said, but I didn't say it because you know, I'm expressing, you know, restraint. I want to be congratulated for this. And she said, congratulations, but not as much as if you had said nothing at all. I say this because I'm going to now tell a joke that would be inappropriate to tell, but it's me. And it's an easy slam. It doesn't mean anything, but Eddie said vestigial and raw and, you know, before we invented fire. And I was going to say, you remember that, Andre, don't you? And then I stifled myself because I thought it'd be inappropriate to insult my fan. But then I thought it was funny and I said it anyhow.
Joe, he's got a join MDG sign right behind him.
I know he does.
Why would
I
you-
could have just easily thrown it at any of the white hairs on the call, but he seemed the most fortified to take it.
All I can tell you is no matter what the color is, it's still there. So
Hey, what? I know. I'm with you, James.
Why? Never did anything to you.
My father had great hair, and I was like, but it's the maternal side. That's the problem. And my mother's father, he did me no favors in that regard.
My grandfather had an incredible comb over for many years. Like the wind would blow and like it's over here. It was awesome. But I decided to go a different route with my.
It looks good on you. I don't think I could pull it off very well.
Yeah, I gave it a try one day because I knew it was inevitable, and then just never went back.
All right. Well, Jorg, you're challenged. Have you anything to add on this topic?
Thanks very much. I'm challenged in many ways. Yes.
Oh my God.
It's
My
still there.
topic for today is gonna seem so much more relevant after this conversation.
this is
Well, you know what? Best segue ever. What is your topic for the day?
What's that?
This is a great entree. You said this makes your topic even more
I
relevant.
thought you were going to say something first. No?
I'm not going to say anything.
Okay, you want me to just jump right in?
Jump right in.
Okay, so I'm going to jump right in and just say that that if Joe were not someone who the first time I opened my mouth at an exponential medicine, people talking about nanotechnology and robotic surgery and all these devices and things, and jumped up and made a comment about how he appreciated what I had just said when I was the extreme outlier of the group, he would not have convinced me to present in this forum. But as background for those of you who weren't on yet at the beginning of this, I am, and I'll say my background kind of in an official way, is I'm a pediatrician. In my head, I'm a very academic medicine pediatrician, born and raised with two very academic medicine parents. I've got an identical twin sister who's been in the early stage technology venture capital world for 25 years. So I followed the technology side, except that she was not health related. And anything around health technology, when she'd get tied in Silicon Valley, she was written up as as the most connected woman in Silicon Valley. She taught all the health tech stuff to me. So that's where very early on, I was following it, involved in it. And I did major in cellular molecular biology, and I was going to be a neurosurgeon. So that's my hard science in my head. That's who I am. And then I became a pediatrician. I opened a childcare center. I do early literacy. I wrote a book on potty training, and I got to be known as a parenting expert, which got me kind of far outside that realm of where I saw myself. But I always thought, for example, my mother was big in public health. I always said, look, I'm doing public health. I'm just doing new age public health, right? How do we translate this, get it out to the masses? And certainly I started from how do I translate biochemistry and cellular molecular biology and calculus to people. And then I moved into how do I take complex things, including health technology and innovation stuff, and translate it to people. I always say I live in the world where half the people I speak to don't know what the letters AI stand for. So with that as context, you saw the topic for today, but what I've learned to say to people, so I thought I would make it the topic for the day, is how to look at what I do, which is outside the four traditional walls of the healthcare system, and why I ended up there, because early on seeing that what happens outside the four traditional walls has a huge impact on health outcomes. So is that good for framing, Joe? We're good.
I think this is an appropriate time to just take a little break so that the people at home can applaud. No, but seriously, it's so impressive.
Thank you.
Mhm.
What I thought I would do in the spirit of Nick Anderson, because I liked the format of, do you have a couple slides that capture, or images or equations or something that kind of captures this? I do I spared you a lot of the details, but I've done everything from own a child care center to connect early brain and child development to 21st century jobs and workforce. And I've been given everything from, 2 hours to talk to 30 seconds, get your point across, tell us how to save the world. So what I've found is that it's really nice to have a couple images or infographics that capture sort of the essence of what we're going to talk about, and then we can just jump into the conversation. So Joe, do you care? Am I able to share my screen?
Go right ahead. And
Let me
while
see
you're
if I can
doing
get
that, Lee Stein importantly asks if your twin's name is Ellen.
Yes, my twin's name is Ellen Levy. Somebody has met. We actually look a lot alike and sound a lot alike. So if he was showing up now, I'd be say, you are not even listening to me. You just are looking at me going, I know you from somewhere,
Really?
because a lot of people recognize Ellen. So you can tell me after this how you know my sister. Let me jump to presenter view, scroll down, and hang on a second, I didn't get this set. Okay, here's one of my favorite images, and this is, I'm going to get rid of the screen sharing as quick as I can so that we can jump into a conversation, because I love your podcast for that, Joe. But what I often catch people's attention, especially on the more healthcare, health tech side, and they're saying, why is someone like me talking, is I ask people, what % of health outcomes can we attribute to traditional healthcare interventions? And when this infographic came out, which is used by the Robert Wood Johnson Foundation, the American Hospital Association, et cetera, it's
I've
very
never
striking.
thought of it this way. It's so interesting.
20% of health outcomes, which means that all of the stuff that's done in that sort of traditional healthcare, it's still really important, right? Like we still do important things. But if you look and say, okay, but what about that other 80%? And for people who are hearing things being done out of traditional healthcare and wondering, what does this have to do with us? My husband's an orthopedic surgeon, and he's like, why do I have to deal with this broader world? It's this. It's health behaviors, physical environment, and socioeconomic factors. And if people are hearing social determinants of health, and we're trying to wrestle with how do we include those things in the electronic health record, and how do we tag them, and what do we do about them, and how do we pay for them? It's because of this 80%, 20%. So I'm going to keep
what
going.
you just shared, it's almost as though I heard Nick Anderson talking. Like the way you guys present and discuss topics, very similar.
Yeah. Well, and what's interesting, because Nick has been on it, but Nick and I connected after, Joe, you introduced us the first time I came to your conference, and Nick and I connected afterwards. And so we've been meaning to get together. I'm not sure we entirely agree in our worldview on things, and I'm looking forward to sort of Nick's input on some of this, because some of this makes the case for even healthcare dollar investments in things where a lot of people still don't see them as a place to invest. And I've gotten into the economics of all of this, so I'm interested in Nick's opinion on it. But let me flip to just a couple points, because then I want to get rid of the screen sharing.
Okay.
Next one. This is an infographic. that I pulled from a healthcare financing paper. So again, Nick comes to mind and we'll see what he thinks. But it was also presented, I was invited to present the case for investments in early childhood, like early brain and child development, at the National Academies of Sciences and this like Children's Council, right? So it's sort of highest level. And a lot of the people who are on the council are on this paper. And you'll see that they did they did a 1.0, 2.0, 3.0 framework. And it was related to, again, healthcare financing specifically. I'll let you read. I don't like to read slides to people. But what I did was I took this concept and I said, you know what, this applies in a much broader, easier to understand, people feel it and see it in the real world context. And what I talk to people about is Health 1.0, roughly broad brushstrokes, first half of last century. Okay, and that was acute illness, right? Infectious diseases, surgical treatments, all those things. My dad was a pediatric cardiologist. That was the heyday of figuring out what to do with, cardiac defects that would kill babies. And now people can live into adulthood with them. Then you get into Health 2.0, second half of last century, and all of it still exists, but chronic disease. And that's the era that I trained in 80s, 90s. Which, and by the way, I only don't have gray hair because the gray kind of blends in with my natural hair color, but I'm getting there. But that's where we get chronic disease, and everybody who's been in the space, including healthcare financing, certainly, I still remember these discussions of what do you do with patients who start to live with chronic diseases for 20, 30, 40 years, people who need to be in a hospital or in some sort of care setting for 4 months. And all we had is those 4 traditional walls of you had hospital beds, intensive care units, and home, right? Like you didn't have in between. So we expanded the 4 walls of the traditional healthcare system to start to do things, whether it was, visiting nurses and long-term rehab and those sorts of things. And then technically it was the 90s, but like now into the first half of this century, we're getting into wellness and prevention. And you can see it kind of mirrored in the financing discussion, but it's a much broader discussion. I like to tell people when you get to wellness and prevention, 2 inherent things. I think, Joe, this is the talk I gave when you and I first met. 2 inherent things happen when you move into wellness and prevention. 1, you move outside the 4 traditional walls of the healthcare system because prevention doesn't happen in the operating room. Surgery is still very important. Again, back to Nick and his appendix and his gallbladder. But you also go young, right? Because if you're looking for root causes, and the younger we prevent problems, the more impact over a life course that you have. And I always say then, welcome to my world. In that context, again, I'm a pediatrician by training. That's my passion, is children. And I can tie any topic you bring up to kids, and kids are families and families are communities, and it can go very broad very quickly. I jumped in the adverse childhood experiences realm because my goal was the question of how do we improve life outcomes for children, especially those born into poverty and adversity. And for those who don't know the adverse childhood experiences study, the original study done in the 90s for a couple of years, yes, it has its flaws. It was about 17,000 HMO patients in the Kaiser system in Southern California in partnership with the CDC. And they were asked retrospectively about adverse childhood experiences that they'd had. And so, of course, you could point out all sorts of design flaws, but there's been all sorts of work in the space afterwards. But the take home from that original study saying, and they were defined adverse childhood experiences in the categories of abuse, neglect, and household challenges, which might be an incarcerated parent or depression, parent who is depressed. A strong and graded correlation between the number of adverse childhood experiences and health outcomes. I always say, diabetes, heart disease, hypertension, suicide, drug use, teen pregnancy, some sorts of infectious diseases, and some forms of cancer.
You said number of experiences. Do you mean number of categories?
Yes. And that was one of the original design flaws, is that if, for example, somebody was abused once, right? Versus somebody who was abused on a daily basis, that was one adverse childhood experience, was that category of abuse.
Right.
But even from this really sort of flawed initial data, it was stunning. And what I thought to myself as somebody who really comes from that—
You're saying even flawed, the delta between one abuse and multiple abuses?
Yes,
it was not so
ideal.
Striking?
Well, the point being, would we really say, okay, you're exposed to it once versus you're exposed to let's say physical abuse 500 times.
Right.
You all count the same. That's
no,
all.
Of course you don't. But are you saying that, as you'd expect, the impact of 500 times is 100 times worse than once, or you'd be surprised?
Well, that's where the study was flawed, because it doesn't tell us anything about that.
Sorry, what?
This is broad brushstroke, so it didn't tell us anything about that. We couldn't start to do more of the precision public health approach to this and hone in on, well, if it happened once versus it happens 500 times, those are very different scenarios. What does that tell us?
Right,
the initial study just sent out this red alert saying, if this, exposure to adverse childhood experiences was more predictive of these, undesired health outcomes than things that we do when we measure blood pressure or when we do very sort of the biometric measurements. It's worth paying attention to. That's what caught my attention. And in fact, the now Surgeon General for the state of California, Nadine Burke-Harris, part of the reason she rose to the prominence she's at is because she started running her pediatric clinic in a high poverty, high adversity community in San Francisco, where she started doing ACE screenings at the same level that we would do blood pressure, urine screenings, sort of our more biomedical kind of metrics. So with that, this is the framework that people often use for anyone who's not, involved in the ACEs world. We long knew sort of like at the bottom of this level that there's social conditions and contexts and things that are going on sort of at the, kind of social side. And then there was this big void in the middle where we didn't know what got us from that to disease, disability, and social problems. But the ACEs study showed us that they were connected. And there's been a lot of work now on how do we say all of these things that happen that are much more in that sort of social, environmental, behavioral realm, how do we get to literal disease, disability, and even death, right? The morbidity.
Tell me, I'm interpreting this
Mhm.
as just the foundations that go to early death are more rooted in mental issues than physical. Is that what I'm seeing?
It can be both, because again, this is where, and so Joe, you're hitting the nail on the head, where I live in this sort of no man's land of, is it medical? Is it social, mental? Is it physical? And the brain is a particularly good example. Is that health or is that education, for example, right? Or anxiety or depression or all of these sort of mental health issues, but they have a very physical impact, right? You can talk about cortisol, you can talk about regions of the brain that are involved, you can talk about elevated blood pressure, toxic stress, sort of body reactions, and that's really physical. I think of that as sort of a missing link, how we're starting to connect what happens in our environment and with our social, mental, behavioral side to what we always did in the very much more biomedical side of things. And that's where at the top of the pyramid is what we saw with the early death and disease, but we didn't fill in those blanks. There's now where we see a lot of discussion where people and again, I always use my husband as an example because he is very deeply embedded in the traditional medical healthcare system. But as an orthopedic surgeon who does joint replacements, he's now all of a sudden having to deal a lot with obesity. And then because of obesity, diet and nutrition, because a majority of his patients are obese, if not morbidly obese, who then end up needing joint replacements. And you have to deal with all the contextual stuff. Okay. The last thing, and just because I don't want to spend too much time before I flip this off, I'm just going to say, if you then start to look and say, what are people now looking at in terms of preventing adverse childhood experiences? Just kind of take a quick look at what could we do if we prevented exposure to adverse childhood experiences, right? And of course, you're dealing with parents in prison, you're dealing with mental health, you're dealing with all, the abuse, neglect kinds of things. And by the way, neglect can be food insecurity, lack of housing, all these things. And look what we do to what I always say, much more the traditional healthcare diagnoses, right? Depression, yes, but COPD, asthma, kidney disease, stroke, coronary heart disease.
It's intuitive that you shouldn't be smoking and heavily drinking. It's intuitive to me that if you're unemployed, have low education and no health insurance, that's going to have an adverse effect. The top one, I don't understand. Are you saying that's the result, or is it causal, or what?
Well, that's where people are now focused. That's the case I'm making, Joe, that if we want to look at just purely medical diagnoses, that we need to look outside the four traditional walls and start to understand better. I think there's a huge opportunity, including using medical devices and epigenetics and all the omics and all the everything else, to start to try to figure out at the same level of sort of granular detail and understanding that we do for other medical things, how those social, behavioral, environmental things cause these things. And there are theories and people are doing
so
work
the health conditions is the result. It's not if you because the other things are, it'd be great if you prevented smoking, drinking, unemployment.
Yes.
You're not saying prevent depressive disorder. You're saying depressive disorders would show up 44% fewer fewer times if.
Yes.
And is it just the two on the bottom? No.
No, what you're basically, I think your question, Joe, is we know what's at the bottom now, right? You're hearing a lot of discussion about social determinants of health, and we know what's at the top, early death, disease, disability. And now the area of opportunity is how do we link those? How do we figure out why are they so strongly correlated, right? Increased ACEs, increase in those things. So your question is exactly where I think the opportunity is And I think it's the linking the traditional healthcare system to realms where people often think it's not our domain in sort of the more traditional
Okay,
healthcare.
let's jump off from there, and I think you're done with your slides, so.
I am, but I want to, there's one I want to show you. This is the last
Fine.
one I was going to show you.
Fine.
Actually, I'm going to show this one for Nick. You don't have, you can kind of skim it, but this one is based on some research done by Elizabeth Bradley, who does a lot of work on both in the United States, comparing states' spending on prevention versus treatment. But she also does global look at what countries and who spends more on prevention versus treatment, and looking at the inverse correlation, right? The more that countries spend on prevention versus treatment, the better health outcomes they have. And that to me kind of speaks, and I'm interested, I mean, I'm like seriously interested in Nick's opinion of this, because to me, it speaks to making the case along with those other slides on why we should be investing in these prevention things that we haven't always considered our domain, and using all of the power of all the cool, you know, technology, data, AI, whatever we use to be looking at this. And this
Nikki,
is the
raise
last
your
part.
hand if you want to come on and talk to any of this. I know
Yeah, and
you're
I'm gonna get rid of my
convalescing.
slides. This is just the last one in case I was getting too ethereal for people. Where you say, look, we've got precision medicine and we've got all the omics and all the really cool, shiny things. But if we start to look at precision public health and say, how do we take that and we expand our view to apply those sort of principles and techniques, right? The customized, personalized, granular stuff, and start to operationalize it and scale it on much more of a population level. That's what I'm going to say. And now I'm going to stop my sharing. And we can, and look, Nick's already on. Excellent.
He is. I don't know if he's courageous enough to
I
show
don't
us
know if I'm
in convalescing, but
like talking.
I'm not courageous enough on camera. And sorry, my voice is so scratchy from the tube, but
oh, charming.
yeah, I know. And I can't clear my throat because it hurts my gut.
Oh no.
I'm a wreck.
But his need to speak is so great.
So great, I can't control it.
Fair enough.
So this is fantastic, Laura. And there's not a thing you presented that I would disagree with. As a health economist, I don't do so much work on public health. You know, I'm a medical device, nitty gritty reimbursement. How do you get this thing paid so everybody can become a millionaire? On the public health thing is where I'm starting to dip my toes a little bit more. I just had a fascinating breakfast the other day with a very close friend of mine who reports to the CEO of Humana.
Okay.
And Ben is from Utah. I went to junior high and high school with him. He's in town. We just went to breakfast the other day. And I started talking and I said, you know, essentially what I mentioned on this podcast the other day about physicians working for the health insurance company, instead of being, as I say, and I'm purposely being inflammatory when I say it, insurance company money extractors, right? The economic role, in my view, of a physician in the United States is to get as many RVUs, relative value units, from that patient's insurance company as they possibly can. So when I was talking, Ben just got this glimmer in his eye. He used to work for Clayton Christensen's think tank in InnoSight, Harvard business grad. I mean, Ben's the top 1% in healthcare right now.
Nick, I know you're not feeling great. Could you bring the mic closer to your mouth?
Yeah, I'm sorry. Is that a little better, Joe?
I'm sure it will be. Go ahead.
So Ben pulls up on his phone this little slide and he's like, look at this. This is a few $1 million worth of research we've done at Humana. And it's confirming the fact that providers have very little incentive to prevent illness.
Right.
And
Not financial anyhow.
right. Why would a physician, just like an auto repair company, auto collision repair companies don't want you to not get in car accidents. That's how they get paid. And
Nick, I grew up in Michigan, and I moved from Wisconsin to Michigan right before I got my driver's license. And in Michigan, they didn't require us to take a road test to get our license when we turned 16. And we joked about it, saying it's because they want us to crash and buy more cars, right?
Totally, Michigan.
Yeah.
Yeah, but so I like, there's a thing that you mentioned, and you didn't say these exact words, but it's to your point, Laura, that that it's being found more and more that a patient's health state has far more to do with their zip code than their genetic code.
Yeah, I use that all the time.
Right? Isn't that? I think that's a wonderful.
I'm sorry, zip versus what?
The saying is that your zip code is more
Yeah.
predictive of your life outcomes, including health outcomes, than your genetic code.
Wow. And genetic though.
Here's the thing, because you got epigenetics, which of course is it's not just the genes, but what turns them on and off and what's sort of the pre-programmed, and that becomes environmental as well. So you get deep into whether it's epigenetics and exposure. So you've got your core genetics that you start with, but then you've got a whole lot else that then influences whether you actually manifest a disease or do all these, all these things that we look at for things. And it is, by the way, the line I use, because again, I'm doing a lot now advocating for investments in early childhood. And I figured out how to cross the entire political spectrum because I've done congressional briefings. I've done a whole lot of stuff in this space where I say, nobody, doesn't matter where you fall across your political spectrum, nobody likes to hear that it's not 100%, but it's getting increasingly easy, like really easy to predict a child's future life outcomes based on the zip code they're born in.
Hmm. You know, and one more thing on to that epigenetic standpoint is you grow up in a household where your mom and dad tell you you're an idiot every day, and your school teacher yells at you because you're the slow kid in class. And then the guy grows up and he's 500 pounds and he's, making minimum wage somewhere. And you go, what's the matter with you? Why don't you go exercise and eat better? And the guy wants to look at you and say, do you know what I lived through?
Mhm.
Spare me that, and this is where I become a religious fuddy-duddy, as Joe knows that I am. And I go, why do you think Intermountain Healthcare gets such fantastic outcomes? Because they treat a population in Utah who believe largely, 66% of us do, that you get married before you have children, and that there needs to be a father in the home, and that you tell your children you love them and you worship God. And all of those things turn into a really healthy society that Intermountain gets to capture the benefit of.
And you know what, Nick, I will make you happy by telling you that, a lot of people, because again, all of this gets politicized, it gets tied in with religion and things. I kind of stay neutral. I'm Switzerland. I'm just telling you what the neuroscience shows, what the evidence and research base shows. But here's what I will say is very clear now. One of the two things on the early brain science side predicting these life outcomes for kids, I say, okay, first of all, we know foundational development. I've been dealing in the world of sort of skill development and the brain and what kind of develops from a foundational standpoint. We know that there are certain things and skills and competencies that set kids up for success, right? Whether it's health outcomes or jobs, workforce, or whatever your metrics are. The other one, though, probably the single most important factor getting kids off of dismal life trajectories, right? Getting them off their zip code trajectory is a caring, responsive adult. And the data very clearly is showing two parents better than one, right? And it's not just for the parental part, but the not at risk of falling into poverty or becoming homeless or whatever. If you've got a single parent, they're much more at risk. Two better than one, does not matter the sex, one better than none, right? And the question I ask at the end of every talk I'm giving on the subject is, and what does it mean for the kids who don't have that? And that's where you get, whether it's teachers, coaches, clergy, somebody, because at the early brain development level, but I'd argue, as you just pointed out, Nick, at all levels, we are very much social beings. And in early brain science, the saying is that the caring, responsive adult is literally responsible for connecting neurons in the developing brain for better or for worse. Our brains over every other part of our body develop in response to the environment that we're exposed to, both physical environment, but also the interactional environment. And this, to bring it back to medical devices and groups and things, this is where I say, if you start to look at what is the cool new capabilities on whether it's neuroimaging or real-time assessment of, interactions in terms of brain, whether it's, whatever the technology is, some of the stuff around mindfulness meditation, but being able to parse that out at a sort of much more neuroscience level rather than a just sort of, again, what some people kind of discount as sort of the ethereal level. There's all, and then using the big data, using AI, using all these things, there's opportunity to be just as medical, technical, data, AI kind of driven as there is in the precision medicine and stuff, but in this realm, because we don't know how those are all connected, but we're seeing very clear data that they are.
Let me do a little bit of hosting and directing. Nick, you plan to give a health economics presentation, a workshop at 10X on May 10th?
Yes, I'll be there.
What do you say, Laura is your sidekick? I think you guys would make a really dynamic team.
I would love it. And
I would too.
Laura, my undergrad was in behavioral neuroscience at Purdue. My master's degree is in bioimaging of the brain.
Nice.
Everything we're talking about, and for the few technicalities where maybe you and I have different opinions, it pales in comparison to how much you and I have in common.
That's what I've been struck by, and I'm always looking for differing opinions. That's why I'm very sincere about, push the other angles. But you've heard it here first. I'm actually, and Nick, we can always talk about this more later, and Joe, you might be interested. I'm about to potentially have the opportunity to become the CEO of a company very focused on all aspects of brain science related to the real world, because I'm potentially partnering up with somebody who can do the funding and the corporate structure for it in a very, very large scale. So we may have lots to talk about. going forward.
As a pediatrician, you know, I think of my kid's pediatrician. We go in, she takes their temperature and things. Do you do that at all anymore?
I don't do clinical pediatrics anymore, clinical practice anymore, because, and I did it for a lot of years, but there's no way I could be doing what I'm doing now, because
Yeah.
for me to put together, I've had to school myself on economics, on policy, on the implementation science. I sit between health and education, because again, if you're doing the sort of brain science, and I've gotten pretty deep into the world of work. I mean, next week I'm presenting at Global Skills Day, and I keynoted at the World Bank. Right. So my problem is it goes very broad, but I try to go deep in a lot of areas. And at the same time, I am very interested in, you know, the nitty gritty of medical devices. I mean, I
I'm
advise
sure Lee would
companies.
really be happy to get to know you. Lee, you've been very patient. I'm going to ask you to unmute. And what is it you wanted to contribute to the conversation?
Oh, I was just, thank you. Nice to meet you, Laura. I had seen Ellen recently when she came down in her fancy new camper van Sprinter.
Yep.
Yeah, with Lori, escorting Lori. And
Yeah.
I've known Ellen since her Kiritsu days at SoftBank. So we go back 25 years. And one of the things on the medical device thing, and she's spectacular. So it's nice to meet you. And she's one of the people that I respect most in this world of technology and the intersection of innovation, even before her journey into LinkedIn. So,
and Lee, you know what I always say? Ellen went into computer code. I went into genetic code.
That's fabulous.
We're not that different. We just went into the different, you know, professions.
Well, she's an amazing human being. I have tremendous respect for her. And my location changed, so I can't stay on much longer. Okay. But I wanted to say that what we're looking at with a lot of these medical devices or the medtech revolution, we're also looking at it from the standpoint of what we're calling the new vital signs. Basically, because from the standpoint of cognitive, from the standpoint of respiratory, from the standpoint of all of the omics that you keep referring to, there's a whole new set of vital signs that are not part of any physician's clinical training. And we just think it's time to kind of leapfrog over all of it. It became a little bit, one of the things that Joe and this network are very, very good at.
What a cliffhanger, right?
Right when he was about to say something nice.
I know. I was like hanging on the edge of my seat for a compliment, and then his phone cut out.
Oh no, Lee.
We have to fill in the blank, ladies and gentlemen. What's the best thing about me? That's probably what he said.
Well, clearly, Lee and I are going to have to connect and discuss more as well. You know, we can have a little.
I'll be sure to do that. In fact, haven't I given you I'm going to get you on this Slack channel.
Talent around FDA registry. So I would encourage you to say.
Oh no. We can't hear you now.
Is that working now?
No, now it is.
We haven't heard you since you were this close to complimenting me.
Well, it's a spectacular network because one of the things that's missing in the medtech world and in these two worlds is the medical world that you're coming from seems to start with a symptom, because the symptom creates a billing code, which leads to a diagnostic, which leads to a billing code, which leads to a therapeutic, which is tied to a billing code. But this other world is all pre-symptoms. And so it's not part of the medical world because it's not welcome in the medical world. And it's not part of the VC world because the revenue of the billing code takes precedence over the social determinants.
Yep.
So
you know, Lee, I was engaged by the Robert Wood Johnson Foundation when they were looking at their funding strategies. They said, Laura, you're the only person crazy enough to say you could do a 10-day turnaround for us. Could you do a survey around the country of who's doing what and where in terms of health systems transformation? What's the financial model? Is it sustainable? And do people think that health systems transformation will come from within the traditional hospital healthcare system? And the fundamental thing I came away with was the financial system, the incentives do not align. I'm very interested in this idea of value-based payments versus fee-for-service, because if your whole point of getting paid is someone breaks their bone, they come in, you fix it, you get paid, and now someone's telling you your job is to keep somebody from breaking their bone or becoming overweight or something, what's the financial model there? And what I heard from some of the top financial people around the country, you know, health economics and, you know, people who've done this at state levels and things, was cross-sector partnering. It can't be done just within the system, that there is hope there, but it's a really interesting thing to wrestle with. And that's where I'm looking at, we need to have a massive transformational shift if we're moving into wellness and prevention like we are, because we're not set up from a, that health financing papers, our financial model for healthcare does not accommodate wellness and prevention very well, is what
Okay, so I'm gonna, the comment I was gonna make about Joe is that there's an expertise required in FDA that none of the tech, I can't say none, but the vast majority of tech companies are building devices in search of a market. The market's there, the demand's there, but the access and the sophistication that Joe and the people that are part of Joe's network can bring to the table. So I compliment this network, and I compliment Joe in particular for basically having that expertise and being enabling a bridge between tech and that world that you're describing is not serving humanity very well. But with that, I ended up switching to a car that I'm driving, so I should not be doing this while I'm driving. So I'm going to say goodbye and thank you very much.
First, thank you. And who's your passenger there? You just kind of did that real quick.
My dad.
Hey, Dad.
Visiting my dad. So he showed up while I was listening to Laura, but because of the Ellen comment, I didn't want to hang up quite right away. So I'm going to hang up and say hello to Ellen from Lee Stein.
I will tell her you
guys. Bye-bye.
All right. Thanks, Lee. Bye. That was fun. One of the things I wanted to ask you, and I don't know that we're going to come up with a solution. There was a story this week about raging infernos in the West and grotesque flooding in Arizona and heat waves in Seattle, etc. And a reasonable population believes that there's a human factor and global warming, climate change, and this is only going to get worse. And the article went on to say, like, yeah, but we're not likely to do anything because it kind of like happens and we can't see it.
Right.
And so, if you see two people speeding in a car and one of them is drunk, you're like, we have to stop drunk driving.
Right.
We must put on a seatbelt. But if it's like, look, I mean, I am wholly unaware of my carbon footprint right now.
Right.
I have two lights on. I have the light overhead. I'm on my computer. I'm using bandwidth. My home is heated. I flushed the toilet today. I washed some dishes. I ran the dishwasher.
Right.
Did I make the world worse today?
So there's a lot of things that you just said that I spend a lot of time involved in thinking about.
Well, let me just think the punchline of that, just so we don't go too far to drift,
go ahead.
When you talk about all of these environmental and mental factors about a child, you're like, I fed my child too much sugar, but I couldn't really tell, or, all of these, given what I consider to be an existential crisis to humanity, that mercifully I will die before and I will not have to worry about it. But it's coming toward us, and we're not responding to that. So how are we supposed to, as a population, say, yeah, if I did exercise more and I got a better education? And
so this is how I fell into media and health communications, because how do you help people feel it and understand it as it relates to them in their world? And one of the things I did, right, is, so first of all, my mother, again, very academic medicine, was dean of one of the top schools of public health, ran the US AIDS.
From an amazing family.
But here's what my mom used to say: when you distill it down to its core, there's one, two, and lots. And the problem with the way we process information is we don't do well with big numbers. It gets to be much more like impersonal. We don't feel it. We don't sense it. We don't see it right around us. This is where the neuroscience also comes in, and how do we process information? There's a couple factors of what you just said. First of all, we are way more wired for short-term thinking. Humans have a hard time with long-term thinking, like projecting out, which is why don't eat the Big Mac today if you don't want heart disease when you're 50 is a problem.
It's just one Big Mac.
And I've targeted healthy nutrition in children in a book called Food Fights. That was obesity prevention and heart disease and everything else, but it's bringing it down to how do you change eating behaviors young? And you have to do it in very tangible, real world, what do I do kind of ways, but try to get people that bigger picture perspective. Why are you doing this? But that alone does not motivate people. And I went to the point about climate change and how do we kind of do this when we're just little like microscopic beings in this big universe. I went to the American Public Health Association, and one of the former heads of the EPA was speaking, and I can't remember her name now. Word finding is so hard during the pandemic, my brain a little bit lost its ability. But the woman, I think it's Jana somebody, but presented about Environmental Protection Agency. And she's like, it's a public health agency. It's not, there's the environment over there and there's the health. It's human health and what impact does the environment have on it. It's not just environment for environment's sake. And people don't even get that. That was sort of like a revelation in a way to frame it, where I was like, I don't follow the EPA, right? I'm doing pediatrics and then health and healthcare and now public health. Humans and the way we process information, first of all, the amygdala kicks in when we're afraid, uncertain, rapid change. We don't think well, right? You shut off your prefrontal cortex and your ability to think through your actions and kind of make reasonable, intelligent decisions based on new information. When you're afraid and uncertain and rapid change, your brain shifts into a different gear. That's why when you see a car speeding at you, your brain shifts into a gear and knows what to do, but you don't see the climate change speeding at you, right? And our brains don't work well. So part of the challenge in health communications and behavior change and a lot of the things I do is, how do you find incremental ways or anecdotes or things that people actually can feel and internalize? And then they start to see the bigger picture, but it is a huge challenge. I mean, I deal in that world of climate change and food systems and, things about shifting climate and infectious disease and which organisms live in which climates. And now we're starting to see, whether it's different things in different geographies. But it's a tough one to pull together. I would say, I live in Nebraska. Here's my phrase for that, Joe. It's like trying to convince people in the state of Nebraska to save the whales. We could not live further from a large body of water that would allow for there to be whales if we tried. And it's not that people in Nebraska don't care about whales, but you have to start to connect the dots for people of how that matters to them. And it may be because you have like multiple steps along the way, how to string them along to get there so that they care about whales or they care about whatever is not in their immediate vision. So that's a challenge.
It's an unanswered one. It's a frustratingly unanswered one, because we can all say, boy, that Jana, she knows what she's talking about, but okay, now what?
Yeah. And I'm a big into the, okay, so I always tell people a lot of what I do, I'm the warm-up act. We need to do something. We need to invest in early brain and child development. We need to do something about, food habits. But then I'm like, but if you don't follow up with the, okay, I tell people I can sell swamp water as long as I believe in it. But then they say, okay, I can talk to 500 business leaders and they say, okay, what do you want us to do? We believe you. You have to have those, and they have to be steps people think are manageable, right? This is like tiny habits. What's that?
Do you have these things that we can do, should do?
Well,
it's practical. Would anyone be financially motivated to?
Well, that's how I got into the finance part of this, right? I started looking at social impact finance bonds, and I started looking at, how do we get really good research and evidence base to, first of all, justify some sort of intervention, and how in a complex system do we even get the metrics we need to show that we have the outcomes we wanted. The example I distilled that down into is, what if, as a pediatrician, someone comes to me and says, I've got this patient, she's 4 years old, horrible asthma, ends up in the intensive care unit a lot, right? And I tell you that the single best treatment for her asthma is $100 of legal services for her mom, right? So first of all, you kind of say, okay, that gets people's attention. It actually is a real example. I just round numbers off to make it easy. But if you've got a single mom living in a mold infested apartment with a slumlord, and her daughter has a trigger to mold in the walls and keeps ending up in the intensive care unit, and it's usually public dollars that pay for it, what if $100 saves her trips to the ICU and hospital stays? And you've now saved the system, usually mostly public dollars, $100,000 by using $100 to pay for legal services. But my next question is always, and how would you ever know in our current siloed system? Because we may track things along an education system or a health system or a social service system. But one of the things I've gotten really deeply involved in, and actually doing a feasibility pilot now in Florida, and in partnership with the health system and a community redevelopment effort, is integrated data platforms that allow for the very secure integration of health education, like the Medicaid data, the community level data that's very protected, especially when you're dealing with high poverty, blighted communities. So that you say, if we do this one intervention, we can measure outcomes. For example, if you do early childhood education, high quality in an integrated system where they have access to healthcare, how do you measure health outcomes? Because we have every reason to think that you decrease a lot of the healthcare expenditures from doing that, but how do you get the data to show that is one of the areas that I think there's a lot of opportunity.
Before Jan asks her question, true or false, your parents used to have Jonas Salk over for dinner?
Yeah, my mom did. Yes. I got to have Jonas Salk come speak at my high school biology class. And it was so funny because it
Oh
was
my God.
it was a friend of my
Talk
mother's. And so,
about
you know, it was just a friend of my mom's. I mean, I was in high school. I knew who he was, but I didn't have this like sense of who he was because he was my mom's friend. I took him into my high school. I never heard my high school biology teacher stammer more in his life. Like he could barely talk, and he had a suit and tie on, and he was, because that was like the dream of a lifetime to come have him talk. There was only like 15 kids in my AP bio class, and here's Jonas Salk hanging out for the hour in the class. But yes, we did. I did have that experience.
Jan, you're on mute.
Well, I was wondering because the more and more I listen to you, it reminds me of how my parents brought me up to eat healthy, to be healthy, to stay away from mold and all that stuff. But they were, and I was wondering, they were depression
Mold,
area.
that was the thing your parents would lecture you on?
Yes.
Mold.
How to eat right, how to concentrate and do things well. And yes, I did get spanked an awful lot, but they usually explained why. But that kind of stuff, they were depression youngsters. And I am seeing and wondering if a lot of the issues we're getting into right now is because the baby boomers are bringing up their kids without talking to them about the environment, about health and that kind of stuff. And it really bothers me. My poor kids lecture their friends because of what I was teaching them as I was brought up, what my parents taught me, especially the environment. It's just.
And this is where it becomes very complex because absolutely, I come from the parenting world. Like that's where I was most known. I was writing parenting books. I worked with Dr. Spock in the 90s before he died. That's how I got deep into parenting. And so on the one hand, there's
You're
a
a
lot.
name dropper now. Now you're just
Yeah.
name dropping.
No, that's not name dropping. That's at a very high level.
I
That's
know,
where I
I'm joking,
started
of
into this
course.
broad space. Thank you, Joe. I usually go, oh, shut up. You're not helping the conversation. The point is at this very big, broad context level, parenting is really important. I spent a lot of, 20 years focused on parenting. But I also then came to realize that there's a lot, first of all, that's outside of parental control. And that a lot of parents are fighting uphill battles, whether that's structural, environmental, poverty related things, that I think it's not realistic to say that parents, especially who didn't have that childhood upbringing themselves, how would we ever expect them to provide it to their children, right? So I tend to pull back from is it their fault versus what can we do to build up those capacities? And in fact, there's a quick little video that the Harvard Center on Developing Child has that's really, I think, well done, and it's 3 minutes, is called Building Adult Capacities to Improve Child Outcomes. The shift on focus, instead of just saying the child and their behavior, saying why is that and how do we help build these strengthen these factors. And there's a huge shift in pediatrics and in a lot of realms on the relational and focus on that caring, responsive adult to build their capacities, because likely they didn't have it and it becomes a vicious cycle. If you didn't have it, if you weren't fortunate, I consider myself very fortunate. If you didn't have that as a kid, how can we expect people to instill skills and behaviors that they don't have themselves without some support? Yep, there
I'll
you
share
go.
this link. folks.
Yeah, that's it.
Social challenges that face modern societies, whether it's the ability to work productively, to be a good citizen, stay healthy, have their roots in early health and development. A strong foundation in early childhood results in much better and more effective development later. A weak foundation really puts us behind. The most important thing children need to thrive is to live in an environment of relationships that begins in their family and also extends out to adults who are family members of childcare centers and other programs. What children need is an entire environment of relationships to be invested in their healthy development. We've shown from decades of testing interventions that we can improve outcomes. But the magnitude of those impacts is not good enough. Science is now available to help us think about what we might do that would have a bigger impact than the best of that before. So we began to ask, what could we be doing differently? What could we do to be smarter? Children who are at the greatest risk for the poorest outcomes in learning and health and behavior are children who experience a pile of a cumulative burden of one after another of risk factors. And then the burden is more than any child can be expected to overcome. So we began to focus on the development of the adults. What can we be doing to strengthen the capacity of everyone who interacts with children? This led us to think about the kinds of skills you need to deal with adversity. These skills of focusing attention, planning, monitoring, delaying gratification, being able to solve problems, being able to work in teams, executive function, and self-regulation. They're also the kind of skills you need to create a well-regulated home and school environment in which healthy development and learning can take place. The brain science started to tell us that differences in those skills start to develop in infancy based on the environment kids live in. So how do those skills get built? If you don't develop them early, how do you develop them later? Actually, you can build them later because the period of flexibility and plasticity for this part of the brain doesn't fully mature until age 25 to 30. So then the light bulb went on. The reason we're not getting a bigger impact is not because we don't know about how to influence development, but because we're giving information and advice to people who we need to do active skill building with. Skill building by coaching, by training, by practice. We're not doing that. So we now have developed this theory of change that says we need to focus on the development of the adults who are important in kids' lives. We need to focus on their skills and their needs in order for them to be better, more effective parents, in order for them to be better prepared to be employable, which would enhance the economic stability of the family, which is also good for children. Second of all, we look at many people in preschool programs and childcare centers. And we said, what are we doing to build those skills in the providers? They need skill building as well. And also the community can help to build and reinforce the capacities that parents need. And the community also includes programs in which the people working in programs have sufficient skills. Third of all, what are the major sources of toxic stress in this community, and how can we reduce that? Moving it up to a policy level, how are our policies strengthening communities' abilities to reduce sources of toxic stress and caregivers' abilities to provide what kids need? The development of our human capital is our future. The development of a productive workforce is our future.
I get depressed when I see policy come in there.
Yeah, and it was never my thing until I realized that it's a drop in the bucket if we do things at a sort of a very small scale, and that if we're really going to make change, that I'll mention in case people are interested, because I gave a TED talk that kind of picked up on what that video just showed. And if anyone wants to help me this week, I think it's about to hit 500,000 views. It's my TEDx Chandigarh talk. But this idea of, if I was really going to make an impact, not happy with this, you can predict a child's future life outcomes by their zip code that they're born in. And people talk about skill building. What are the skills, and how can I link it up to stuff everybody wants to talk about? Jobs, workforce skills, innovation, entrepreneurship. As soon as I did, that's where I've started.
Come on, folks, we're just 722
I know. So see,
away.
you just helped me with another one. But the point being that it's we need to get to policymakers and to the economists. And by the way, again, for Nick's benefit, if nobody else's, but the amount that's spent on early childhood is minimal, oftentimes like an accounting error compared to other budgets. And if healthcare dollars, which dwarf the education dollars, if people in healthcare start to see early brain and child development as critical to health outcomes, it's a huge impact on potential health savings, healthcare dollars and costs, but also it elevates the amount that is invested well beyond what's in that space now. Children don't vote, they don't advocate. And so people think, when I say I do early brain and child development, I owned a child care center, I get that's warm and fuzzy, but I'm trying to make it something worthy of policy and investment.
To me, and maybe I'm just too tired, jaded. I don't see how any elected official will make money working on that.
And you know what? When I just did the congressional briefing I referenced, 39 co-signers on the bill during the last administration, bipartisan. Okay. It was platforms in the last administration. If you look, money is flooding into early childhood right now at a level never seen before. And the stuff like that video you just saw is informing a huge amount of work. So I actually see sort of a tsunami of interest coming. So I'm a little bit more positive than you are, because I have, I've crossed the entire political spectrum and I can get people interested at the extremes of both.
Well, I just hope that there's lobbyist money.
Oh, there's, I've been talking to people who are engaging the lobbyists and whatever. There's a lot of sectors, but I spend half my time talking to business leaders, global business leaders.
You're one smart gal.
For investing in early childhood. Thank you, Joe. I appreciate the support.
And that talk was in India.
I know. And you know what? It was at the equivalent of 4 a.m. I said, I will come and speak, but don't put me in the afternoon because of the time difference. And I was like, oh my God, I'm going to fall asleep. Like an hour before I gave the talk, I was like, I can't even keep my eyelids open because of jet lag. So
there must have been enough nervous energy in there to get you going.
Thank goodness it kicked in.
The only thing, and I enjoy our time, whether you're presenting or we're just hanging out. My only want that I don't think you can deliver.
Okay.
I
like the challenge.
Yeah, it's. We've had folks listen to you, your thoughts for an hour, and I'm just afraid that this call is going to come to an end and we're going to be like, that was nice. And then we're going to go back to our jobs and our lives and do things. And yeah, that was good. That was good mental stimulation, but behavior change and any actual movement towards these goals you've laid out, without there being overwhelming incentives, I'm pessimistic.
So let me first say that and part of what I do is how do I even get people's attention? So the case I make in that TED talk is if we don't even have common language where I say something and you go, yeah, that's important, so tell me more, we're never going to get to what you just said. So part of this, that's where I say it's a warm-up act, which is how do I start to get people to even notice what's happening? Now I'd say something like, for example, earned income tax credit, childcare tax credit. Everyone's hearing about it, and checks got sent out yesterday, day before.
Yesterday.
The point being, if you understand that what we invest in the parents in the early years has a very measured impact, like shown impact on outcomes for young children, then you start to say, why is it that we're looking for, whether it's paid leave or earned income tax credit and things, then it's not an issue that's not related to you. It's related to what would you do if you were investing in early childhood? So there's certainly things that part of this is, now you see it. When you hear, like I go to the HIMSS conference, right? Health Information Management. And you know what I go to? Because some of it's way over my head. I kind of get a feel for it, just absorb it. But I go to the, how are we ever going to integrate social determinants of health metrics into our, EPIC Cerner electronic health records? And I start to look where people are trying to do it. And it's really still pretty archaic. Like, we can scan a PDF on something related to mental health into an electronic health record, but that's not the same thing as we actually realize it's a metric that has impact on health outcomes. So we need to enter it in the same way that we can enter the traditional vital signs, right? As Lisa.
Have you ever considered hosting your own conference?
It's come up before. I haven't really thought about where I would start on that one. It would certainly be something I would be interested in.
We should talk about that.
Let's talk about that. That would be fun. You'd do it with me?
Yeah, sure.
There you go.
Conference, that part's easy. But it'll be the Laura show instead of the Joe show. No, seriously, because the people you could bring together, I mean, maybe it's a real platform to make some of this happen.
Fun fact, which seemed completely random at the time, in high school, I got voted most likely to host a TV talk show.
And where was your sister in all of that? Or maybe they didn't even know which one to.
No,
They
I
were
don't.
voting ready for both of you.
She's a little bit, she's not quite the same as me she doesn't like to do public speaking as much. She hasn't done a TED Talk or written books or anything. Oh, Sanjeev is on, who I also met at your conference, Joe.
How are you?
I go to conferences and I collect cool, interesting people that I stay in touch with, Sanjeev being one of them.
Sanjeev, you wanted to add something before we close.
Laura, so, you remember what we were doing at POC. I'm developing with a new company now, HeridiX. Does it make sense to add these environmental issues that you're talking about for diseases? So we are developing an AI with the instrument now, right? Mm-hmm. Rather than just looking at markers and saying, hey, someone's got this, would it make sense to not just look at that and look at the patient's history, but also look at the environment that they live in?
Here's what I'll tell you, and Sanjeev, for people who don't know, I mean, the point of care diagnostics and how do you do, kind of that side of things. I actually think about you, Sanjeev, again, Joe, you reinforced that I wasn't like crazy and out of place at these conferences, but Sanjeev did as well, because he came up to me after I said something or talked or whatever at your conference and he asked if I would be an advisor. And I said, well, you know that cancer isn't my area of focus and that I'm not like actually doing this research. He goes, yeah, I like how you think. And I went, okay, again, super validating for somebody who I thought I could contribute, but wasn't so sure. The answer to, and I think about you and your context, which is there's opportunity along the entire continuum. So what I tell people is, first of all, you can focus on one, you don't have to be the comprehensive worldview of how do you collect the data. And it can be very specific to biomarkers, biomedical sort of data. But I think about then, how would you be able to integrate that into a bigger picture contextual view? The other thing that I'm really intrigued with, for example, around this adverse childhood experiences, how do kids physically experience the effects of toxic stress? And there's people at UCSF looking at what are the sort of biomarkers. Could we start to say it's not just what happens to children, but how does their body then sort of internalize it and become affected by it? And doing those metrics, right, which would still be sort of the biomarkers of things, where we start to make it more tangible and less sort of ethereal, like something bad happened to you, but we don't know what that does to the body. So I think there's a lot of opportunity, but I always tell people, you don't have to like boil the whole ocean, but I think all of us should be looking at what we contribute in sort of very specific data assessments, how that could be tied into a bigger picture, right? How it becomes a contributing part of a bigger picture so that you aren't oblivious to the rest of the picture, the environmental side. And more power to you if you can measure the environmental stuff too. It's just if that's not what somebody's area of focus or expertise is from a technical standpoint, look to say, where could that be synced up? Where can what you're generating be synced up?
So if you do it based on AI, right? You put all the environmental conditions besides the
Yes.
The normal protein markers and the blood or genetic markers. Yep. You may be able to now, the machine may be able to predict much better than.
I think that's very useful. I think that's a really, really useful thing. And I do see people moving in that direction. It's just a lot of people don't consider themselves well suited to do it, right? It's like, it's done too much and scrambles people's brains.
Yeah, let's get on a call later and we can talk.
You know
about
how to
that.
reach me, Sanjeev. It's great
Absolutely.
to see you.
You too.
Before we close, and thank you, Sanjeev, before we close, I'll just read 2 comments that just came in. One of which is from Jan, and she writes, sister study. Sisters of women with breast cancer without having it themselves took environmental information with health information. However, the data was collected only at the start of the study with no information on where they grew up. They're still having interesting results. Are you familiar with the study? This is more rhetorical. Do you want Jan to get in touch with you with more info about that?
I am always interested in hearing more info on interesting
I
studies.
have just invited Laura to join our network with it's in your inbox. You just have to click, then you join, and people will be able to just chat with you this way. Mark writes, I am working with digital health companies based in Finland. They have a well baby system in Finland that has been in operation for more than 100 years. I believe this has been more important in their educational success.
Yeah, it's, again, it's a continuum. Part of what I say is I'm not just an early childhood person, I am a root cause person. And a lot of countries and cultures have left out that early childhood space as sort of like it's your job to keep them safe, changed, and fed until they get to learning. Whereas we now know we have all sorts of great evidence showing that what you do early. So I look at the well baby, which tends to be more like the pediatric well baby kind of things. And the education side, it's all the same discussion to me. We siloed it in our, in our cultures and in our professions. But to me, it all kind of feeds on each other. I can't draw a demarcating line. So that makes perfect sense. And yes, Finland comes up a lot for a lot of things around maternal child health and educational success. But if there's details, Mark, that you want to share, again, I don't presume to, I just go around and try to pick up all these interesting things and put them together. So I'm always happy to hear if you've got more details you want to share with me, please do.
And like I said, Laura will soon be on the network, so you can just chat her that way. I'm going to close with perhaps self-congratulating comment that it just popped into my head that my Zachary said to me yesterday. He's going to Boston University, and we as a family are taking him there in a month. And while you were talking, I was thinking, my work here is done. He's off, and I don't have to worry about the parenting thing. So Beth came to me yesterday, and she said, "Joey, do you want to go to Parents Weekend in October?" And I'm like, okay, but does Zach want us there? I mean, because he's not, like, he didn't care about graduation. I don't care if you come or not. You want me to come to this? No, I know you love me. You don't have to come, whatever. I said, do you want us to come to Parents Weekend? And he said, given the way you guys raised me, why wouldn't I want you there?
Nice.
Why wouldn't I want these people who gave me so much and shared and made me the person I am want to share in my joy?
Awesome. Which means you did something right, Joe.
Something.
You don't get that with, yeah. And that he also had the benefit of there's that clear bond. And my argument, that the case that I make, I talk about the foundational development. My case is we're talking about humans, like in human relationships and human nature. And I think parenting doesn't end. You're always a parent, right? And that even, I'm in my 50s now, I still have some
You're
of
in
that.
your 50s.
Yeah. I told you I have gray. It just doesn't show up because I have fortunate hair color that doesn't show it. But the point being, we're talking about human nature. I make the case in the business world that mentorship and coaching and the new form of leadership is based on the same sense of we need a caring, responsive adult who's in trust, in a trusting environment and stuff. But you just made the case is, yeah, it doesn't end yet. And it's great when your kids surprise you. You think, oh, they're going to be done with me now. My last one is just turned 21. I've got 21, 23, and 24-year-olds. And when they invited me to Parents Weekend, I was like, really? You want me there? Like one of them in a fraternity in sports and does his own thing. And he's like, oh yeah, no, I want you to come. My husband are like, oh, he wants us to come. We weren't planning to. But yeah, see, you did something right, Joe. You got that far and he wants you around is great.
I suspect maybe we've drummed up some interest in the yet to be named Laura Jana
Conference.
Yeah.
That would be fun. That would be really fun.
We'll talk more. Okay, thank you for today. Next week, we have my friend Brian Sullivan, who is going to talk about lead generation and how cold calling is not dead. And
cool.
He's profoundly good at what he does. So you folks looking for more business, see you next week.
Hey, thanks for having me join you, Joe. Appreciate it.
My pleasure. Bye now.